The long-anticipated reorganization of the Philippine Health Insurance Corporation, or PhilHealth, is now underway. The Governance Commission for Government-Owned or Controlled Corporations, or GCG, announced that it has approved the revamp. In a statement, the GCG said the process aims to address several long-standing issues, including PhilHealth's outdated workforce, fragmented data and strategy execution, and issues related to benefit claims. First to undergo restructuring are plantilla positions to improve the state health insurers' efficiency and to address operational challenges. Changes in PhilHealth's internal audit office will also be implemented. A benefit payment appeals office will likewise be established to improve the handling of benefit claims and incentivize healthcare.
And to get a clearer picture of this restructuring at PhilHealth and how this process will unfold, joining us tonight is Dr. Edwin Mercado, PhilHealth's President and Chief Executive Officer. Good evening, Doc, and welcome to the big story. Mukhang natatraffic po kayo. Nasa kotse ba kayo?
Opo, pasensya na po. Sunod-sunod pa po yung meeting. Magandang gabi po, ladies and all your listeners.
Well,
good evening po.
We still appreciate that you're able to talk to us. First of all, what will happen to the employees of PhilHealth? May mawawalan po ba ng trabaho dito sa organization na gagawin?
The reorganization actually is a long process. The last time we had a reorganization was in 2007. So actually in 2015, we had the Development Academy of the Philippines do a study. And it only came to fruition now after almost 9 years of back and forth. Yung pong napipintong reorganization po, may mga bago pong mga posisyong makikreate. Meron din pong mga opportunities for our existing employees to apply for promotion and also for lateral transfers. So it will all depend on what the GCG will be giving us. Right now po kasi it's just as you said, the posting in their website. But we will still need to sit down with the GCG. And in fact, I have a meeting tomorrow to also discuss the details of the program.
How long will this reorganization take?
Again po, we will talk with the GCG. The last time I talked with the GCG commissioner in charge of the PhilHealth, they said that it would be in several phases and would depend on what the organization's need would be. But the soonest that we do it, the better para po panatag ating mga empleyado on the tenure of their services.
I'm sure you're pleased that after 9 long years, magagawa na to sa wakas.
Opo, matagal na pong hinihintay ng ating mga miyembro dito po sa PhilHealth at isa rin pong pagkakataon para po mabigyan pugay o mabigyan po natin ng pagkakataon ng mga performers na medyo naman po umangat sa kanilang mga posisyon.
Okay, so as of now, you still don't have an idea kung paano talaga yung magiging implementation nito, Dr. Mercado. But have you seen the study conducted by the Development Academy of the Philippines since 2007 pa yun?
A bit po, pero marami na po nabago since then po.
Baka
kasi nga
outdated
po,
na.
We also, nagbago rin po when the Universal Healthcare Law was passed in 2018. So yun po, by the mere fact that our mandate became different, that all the Filipinos now are automatic members, and our shift to what we call a prospective payment system and eventually into a healthcare provider network setup, parang it will also change, apart from the mandate, into a more matrix type of organization rather than the current na it's more siloed and different functional units. So it's going to be more integrated, and I hope there would be more responsibility coming from the central office on how to oversee the regional operations.
So, Doctor, during this transition period, will there be any disruptions, any risks that members and hospitals should prepare for?
Wala po. It's going to be in phases, as I mentioned earlier. The operations po will be as usual, And in fact, while we're doing the reorganization, we hopefully would also do the digitalization or the transition also in terms of harnessing technology to make our processes more efficient.
That's what I was gonna ask nga eh. Kasi the last time we spoke, no, Doctor, you mentioned that you want to digitalize para madali yung coordination rin with hospitals. Do you think this reorg will help the digitalization or nasama na ba yon doon sa mga updates done to the study by DAP?
From the previous meetings we had, parang there's already consideration of the efficiency that will be brought about by the digitalization. But again po, it remains to be seen pa. That's why I need the exact details when we meet with the GCG. But we are already doing it as we speak in terms of enhancing our digital process. In fact, we're already hooked up at the eGov app, one of the first few institutions that are hooked up. And you can already see the member contribution, your attribution to your consulta or primary care providers, and even your PhilHealth ID is already attached to the eGov, and already we are using the PhilSys as our identification or our verification process.
While it is rather early, Doc, what improvements can we look forward to, can the people look forward to once this reorganization is implemented in phases, as you had said?
Number one po, yung aming response time and especially our ability to process claim will be shorter. In fact, I already passed a mandate to try to lessen it to less than 10 days from initially it was 60 days, then it went down to 30 days. And I'm looking at further shortening it. So the digitalization process, and if you will look at the initial statement of the GCG, we will also have a separate benefits adjudication unit. It's so mas mabilis pong mangyayari yung mga resolution po ng mga cases na ang mga benepisyo po ay under question or under further studies. So yun po, mas mapapabilis so that the rate of denial and return to hospital will be less. So the short answer po is for our provider, it will be faster, more fair. For our members, it will be better service.
Doctor, of course, under the Universal Healthcare Law, alam naman natin lahat ng Pilipino ay ngayon miyembro na. But what is the difference between active and active members? Sino po ba talagang mga legitimate members ng PhilHealth who can claim benefits? Because there are some na pag hindi ka daw nakabayad ng 6 months, you won't be able to claim in the hospital.
Sa bagong batas po natin ng UHC law, ano na po, point of care, lahat po ng Pilipino is already a member, and there's no need to prepay or to even pay the past remittances. There may be some past due premiums which we will still assess the patient, but hindi po siya precondition to access care. So ang bagong batas po, point of care kung tawagin, pwede na pong mag-avail ng services in all the accredited facilities.
And just recently, Doc, House Speaker Martin Romualdez did laud the agency for rolling out expanded benefit packages, lalo na sa kidney dialysis, di ba? But he also urged to review yung pagsagot daw ng PhilHealth, at least 50% of private hospital expenses. How possible is that, Doc? 50%?
Yes, yesterday nga po, I had a meeting with the Private Hospital Association of the Philippines, and we're looking at ways on how to really mandate a no-balance bill for the ward cases. Continuous po nating pinag-uusapan yon. Our data showed that from initially about 20 to 30% support value po, meaning the percentage of the total bill that is covered by PhilHealth in private hospitals, ward accommodation, is now up to almost 50%. So we're looking at other ways to really bring it up, and also the other causes of excess out-of-pocket payment are also related to doctor compensation. So we're also looking at ways to compensate the doctors in some other ways, meaning more based on outcome and also service quality. So yun po ay certain incentives that we're looking to naman reward the doctors if they perform good.
And Doc, while we're on the topic of PHAPI na rin, of course, we know na tinatry nyo i-pay back as fast as possible yung mga back pay or loans, or not really actually loans, but yung mga utang pa no, nung PhilHealth. Have we significantly narrowed the gap there?
Yung moving forward po, since I took office, medyo mabilis na po our return to hospital and denial rate is single digit now. Our RTH is about 2% and our return to hospital is about 3%. So that's a significant lowering. Ang hinahabol po namin ngayon are the claims prior to my assuming the post. So we just approved a flexible payment scheme where all those claims that were denied due to lapse in the 60-day filing period are allowed to be refiled. So yun po, pinoprocess na namin po yun. So that will significantly reduce the denials and the, kumbaga, as you said, the back payments that we need to do prior to me assuming the office.
So this adjudication board will eventually do away with that long, accumulation rather of debts to private hospitals.
It's not actually well, in a way it's a debt because it's still services rendered.
Yeah.
But it's more how to kumbaga adjudicate and also mediate all the differences which may be related to quality of care, standard of care, and also some missing documents that needs to be attached. So if there's a separate unit that is doing it and focusing on it, mas mapapabilis po ang ating proseso.
So to avoid the accumulation, maybe not debts but billings, billings
Yes,
would be a more
exactly.
accurate
Yeah.
word to use. Pero nagiging debt kasi taon
Pag
na
late.
Pagka kasi po na patunayan na meron pong konting fraud involved, then definitely po it will be denied. So in that case po, hindi na po siya debt, parang denied claims na po yun. But if the claims naman are live and it's a matter of just completing documentation, live claims pa po yun, debt pa po yun kasi services rendered nga po yun.
Dr. Mercado, naalala ko lang because of Pawi's question about Congress and a speaker announcing new benefits for Filipinos. Malapit na kasi mag-budget season, so medyo nandun na tayo sa time na yon. Nakapag-coordinate na po ba kayo sa Congress and maybe with the House Speaker for possible na pagbalik ng budget sa PhilHealth come 2026?
Gandang tanong po yan. We are still awaiting po the decision of the Supreme Court. We think the process that we went through naman is fair. So isa po yun, will there be some rule on what really is the treatment of the sin taxes or the taxes that are soft earmarked for healthcare? But apart from that po, yung budget moving forward, we already presented our actuarially projected benefit payout based on the new benefit plans that we have for the next year. So we already submitted to the DBM, and yun po, once
And
we
how
get
much
the
is that?
numbers po. Yes.
Magkano po yun?
Medyo po yung hinihingi namin po for next year po based on our projected payment po is going to be higher than what we got this year. For this year po, we're expecting about 300 to 310 billion benefit payout po eh. And that is coming off from the previous year's 170. So it's a big, almost 85% jump from the previous year. And then for next year po, because of the ramp up and the new packages that we'll be getting, we will be computing on how much the indirect sector needs. And this is the member sector that are paid for by the national government. The direct sector po are the ones that are contributing
Right.
from the employed sector.
So magkano po?
Moving
Kayo
pa
talaga,
po siya eh.
umiiwas kayo sa halaga. Mahuhulog ba kami sa silya? O ang Kongreso?
Kasi for precisely why we're digitalizing or why we're doing the reorg, is also to cut down on and to improve our efficiency and cut down on waste to para po ma-reallocate namin yung perang ma-save namin to more benefits.
Okay, and tama ba, no? Sige, balikan natin yung reorg, Dr.
Or are
Mercado.
we letting him off on the amount?
we'll find
double
out
the
soon.
310?
Pagka po medyo may firm up na po yung amount, pwede pong right now po kasi moving pa kasi nga po
sige.
yung aming benefit package gumagalaw pa po
We'll save it for our next interview, Doctor. But
Sige
for
na
now,
nga.
sige, balikan ko yung reorg, no? Tama ba, can you confirm that around 7,000 positions yung nire-review currently?
7,500 plus po yung nakalagay dun sa GCG release. Pero yun nga po, we will still be sitting down with them to really do the numbers. Because some, I think, are position counts and not FTEs or not full-time equivalent warm body counts. So we will still go through the numbers one by one.
So, Dr. Mercado, right now, are there plans for further reforms or adjustments dun sa mga benefit packages ng PhilHealth? As we know, yung kidney, nataasan na po yan. But what about stroke, pneumonia? And some members are actually asking sa dental daw. Posible
Yes.
po bang magkaroon ng mga dental packages rin?
At saka optical, di ba? Parang may
Optical.
nabanggit din na gano'n.
Correct.
Kaya
So,
ayaw
isa po,
ibigay ni Doc ang halaga. Ang daming idadagdag.
Darating po tayo dyan. Baka po kasi mag-move pa. Better po pag talagang firm up na yung numbers. But to the question about new benefits, one of the pivot we're looking at is really strengthening primary care. So yung preventive po, more than the curative is what we're looking for. And this is also to answer the clamor of healthy Filipinos saying, we're contributing but we're not getting anything. So isasama na po namin and hopefully ma-announce na in a few weeks yung aming pong coverage ng mga screening. At unahin po namin dyan cancer screening on top of additional benefits po like additional medicines. So yun po titingnan po natin at hopefully matapos na po namin yung pag-finalize po nung benefit plan.
Okay, so yun yung
Alright.
primary
For the
care.
other po, in the other cancers po, we're looking at liver, we're looking at lungs, we're looking at ovarian, prostate, and thyroid.
Wow.
Plus yung sa pustiso po, we're meeting with the Philippine Dental Association actually next week to really map out also additional dental packages.
That's a lot.
Yeah. Kaya ayaw tayo sagutin.
Kaya po hindi ko masabi yung exact figures
nga
kasi ang dami pa pong
Doc,
mga benefit packages.
panguling tanong na lang, this reorganization can be finished in 3 years by the time the term of President Bongbong Marcos ends? Nako, nag-freeze na
Yes
si
po,
Doc.
I think we hope to even do it in less than 3 years. Kasi po nga, we need also to give assurance to our people. Of course, until the reorg and the positions are finalized, our internal employees are also wanting to know what their potential options are.
All right, we thank you so much for joining us kahit na kayo'y nasa kotse. Marami pong salamat, Dr. Edwin Mercado, PhilHealth President and Chief Executive Officer.